So our subjects, John and Michael, are twins who were constantly was being diagnosed as either autistic or mentally retarded. However, they were quite the opposite. They had amazing memory and tended to communicate in numerical code to each other. Almost like a calculator, John and Michael would toss what would seem like random numbers back and forth between each other, and they would calculate the sums and divisions without any use of a calculator. So the gist of their communication was just throwing numbers at each other, and they were able to calculate using their brains and their mental capacity to figure out these sums and divisions and multiplications of these numbers just between them two. The twins were really close, and others quoted that they were connected at the hip up until 1977. During this time, the twins were unfortunately separated and placed in separate mental institutions for their condition, which we have established that they've been diagnosed as either autistic or mentally retarded and could not function socially. When they're separated, their numerical communication was also separated. However, the twins develop a sense of independence from each other. But on the other hand, they did lose that sense of longing for each other and that center they had in their lives, which was each other. So throughout the case study, we can see that the twins are demonstrating symptoms of autism as their main primary condition. So the main areas in the brain affected by this condition are usually the temporal lobe, which houses the intellectual functions, especially since the twins did communicate with numerical patterns and speech. And we can see that there are elevated intellectual properties in the way they communicated with each other. Also, the parietal cortex is affected since it does house the mathematics portion and processes of our brains. And the Broca's area is affected since it normally regulates speech and how we interpret speech and be able to process what someone else has said. Higher functioning in intellect and speech impairments are usually the key features of autism, and we see both of these symptoms in both twins. As mentioned previously, there are key major symptoms and signs of autism that we can see exhibited throughout the case study and in both of these twins. For example, some major symptoms of autism include speech impairment, or in this case, speech it comes in form of numerical communication between the twins. And patients who are suffering from autism usually experience social withdrawal and issues forming close relationships among others. And we see this exhibited in John and Michael as they have trouble forming relationships outside of each other. Some autistic patients experience increased intelligence, which can be exemplified through either artistic behaviors or increased intelligence with technology or mathematics. And we can see this with John and Michael on the mathematics side of things, where they have increased intellect on how to calculate these numbers internally without using any outside calculators or computers to help them compute these numbers. So autism is usually diagnosed through developmental screenings, where physicians will screen for behavioral signs, speech patterns, and movement disabilities that may arise in children who have autism. And these children who may have family members that exhibit this autistic behavior will have to get screened as soon as possible, since they're at a higher risk for developing autism at an earlier age. If a child is showing signs of autism, these patients are then referred to a neurologist and oftentimes a child psychologist. However, autism is often misdiagnosed as developmental delays and is sometimes often overlooked in younger children as just developmental stunting, and they'll just develop and grow as a normal child the older they get. Overall, there is still a lot to learn about autism as a condition as a whole. There are still some unanswered questions. For example, scientists are not sure how many, if any, brain dysfunction causes autism. And scientists are not sure if there are any underlying conditions that are influencing the development of autism, or is it just strictly based on genetics? But what we do know is that autism can be passed down from parents to child, and this is something that physicians and scientists should be aware of and keep track of, especially in younger children who starts developing these autistic behaviors at a younger age.